Hi, we're Team 9. My name is Leanne.
My name is Norma. I'm Christabel.
My name is Sun.
And our topic is on telemedicine and standards of care. When inmates have to see a specialist, they usually seek this care via video conferencing. And this is an example of what telemedicine is. Telemedicine is basically seeing a physician without having to see them face to face. So you can talk to them on the phone or you can talk to them through a video conference. Patients that see through video conference usually are in a room, and the room is usually guarded, and also sometimes there is a physician on site where they can both communicate together and work as a team to better treat the patient that's being seen. So it's very easy for them to communicate. And then there are specialty needs for these patients, but they aren't limited to any particular specialty, so they can be seen for any kind of specialty needs. So one of the needs that were met were psychiatric needs, and that was the highest percentage that was seen in the prisons in 2011. And majority of the prisons are in rural places, so these prisoners aren't able to see physicians as much as they would have been able to if they weren't in the facilities, and so telemedicine actually helps them be seen much more frequently than they would have if they didn't incorporate telemedicine. And transporting of inmates costs a lot of money, and it's very time consuming as well, so that's why telemedicine comes in handy, because then there doesn't have to be guards that constantly have to be with these inmates, and the inmates don't have to be shackled and cuffed, so they don't have to use as many resources with using telemedicine. So prisons try to avoid leaving if possible so that they can cut down the cost of healthcare and then also still treat the patients. So telemedicine actually helps the prison much more than actually leaving to go to a facility to see the doctors face to face. There was a CDC survey that was done in 2016 where 30 out of 45 states actually opted into having telemedicine and adopting it into their prisons so that they can use telemedicine. And it actually helped with healthcare outcomes because these patients were able to be seen without having to leave the facility.
In terms of the prisons that actually implemented telemedicine, just based on this article alone, showed that there were 9 jails that were used from Rikers Island of New York, as well as the states of Illinois and Ohio also reported having positive impacts of using telemedicine. Some of the benefits that they definitely saw were saving time, they saved money, they didn't have to worry about transportation purposes for their patients depending on what kind of care that they needed. A lot of the times, screen-to-screen conversations was a lot quicker for the inmates just because of the fact that in order for them to make an appointment outside of the facility, it took too much time, too much money. They didn't have the resources for it or the funds for it. So it was really important for the physician that was on site to be able to communicate with the specialist that would be on the other side of the screen that would ultimately help the patient in terms of their standards of care for the prison. This comes down to what the primary care provider actually decides for the inmate. This just means that they have to identify if there's like a medical concern needed that would have to require them to actually leave the facility. Otherwise, it would just save them the time and resources for them just to get observed right then on there with another specialist. This also just doesn't mean that it removes face-to-face interactions outside of the facility. It just means that the patient actually receives a little bit more help by staying inside the facility, and they're able to get help from not only the on-site care physician, but also the physician across the screen, which is usually a specialist. The primary care provider would usually suggest if they needed further treatment outside of the facility, so the prison would usually cover the co-payments, which is beneficial to the patient. Otherwise, if they really demanded to leave the facility, they would have to cover the co-payment themselves. Ultimately, for patients that do have, for example, HIV, they were one of the most beneficial of this form of treatment just because 91% of them saw a positive impact just within the first 6 visits of their care compared to the 59% that only use on-care site for telemedicine without the use of telemedicine. So that was some of the benefits that they received.
The impact of telemedicine is significant, as you can see in the statistics listed here.
Prisons benefit from telemedicine because it increases access to healthcare, reduces the costs, improves healthcare outcomes, and also lessens in-person consultations. Telemedicine improves continuity of care and helps patients keep their chronic conditions under control, such as making small changes. This makes their standard of care aspect feel more valued, and the prisons are able to keep conditions monitored at a lower rate. Patients with chronic conditions or illnesses require a lot of care, so it can be expensive to constantly transport them from facility to facility, as mentioned earlier. Telemedicine also allows the patient to receive care they need without having to leave the prison. And again, as previously mentioned, telemedicine complements in-person visits by enhancing efficiencies and improving health outcomes. Research supports positive aspects of telemedicine as it provides access to healthcare needs and patient satisfaction. Telemedicine includes the use of video conferencing to allow inmates to see medical specialists and psychiatrists without ever having to leave the facility. It was initially implemented for efficiency and to avoid hours of transport, and learned over time that it really improves clinical care. And while yes, prisoners are meant to be isolated as their punishment, they are still human beings who deserve medical attention when needed. Some prisoner advocates worry that telemedicine will increase inmates' feelings of isolation because they are being completely removed from all contact with the outside world. One thing the article does not mention is that there can be real material risk of harm from treatment without any physical examination. It's important to note that while the benefits are great, there is also a negative aspect. The risk is greater if the treatment provided to a patient is given to an inmate who cannot communicate his true condition. This graph elaborates even more that with telemedicine, there's higher quality of life, higher quality of care, and higher cost efficiency. The patient, the physician, and the cost bearer all benefit. We've learned that when an inmate needs to see a medical specialist, getting extra care can get complicated, but given the challenges, correctional facilities have embraced telemedicine.
When the jail's primary care provider noticed that an inmate has a medical concern that require a specialist attention, the inmates were accompanied by a security guard to the jail's medical clinic where he can consult with a specialist using video conferencing. Telemedicine offer many potential benefits to inmates, including expanded medical care and access to medical healthcare services. The jail physician and the specialist will work together to consult and clarify the information for the inmates. By reducing the expenses of medical transportation and extra security in prison, telemedicine can help improve the access of care while reducing the growth of healthcare spending in correctional facilities. Due to the status of incarceration, prisoners often have limited access to healthcare services outside of the correctional facility. However, they can still get fast and accurate information and responses from medical specialists without leaving. Telemedicine can also be used to offer care to patients with chronic condition. It is the quickest method of healthcare delivery that promotes the access of healthcare throughout the nation. It is essential to have a specialist who have up-to-date medical knowledge and can provide the best treatment for inmates. This broadens the standards of care, the traditional standards of care between doctors and patient, as it enhances the quality of care and helps the patient achieve better outcome. Dr. Young is an infectious disease specialist and a professor of medicine at the University of Illinois. States that inmates who see their physician more regularly are more likely to have better health outcomes. The takeaway is that the increase in adoption of telemedicine help demonstrate that it improves the standards of care by complementing the physical meeting with doctors, and it helps patients achieve better health outcome. Thank you, and that's the end of our presentation.